We know that coronavirus continues to claim more lives worldwide. It continues to spread. Now, a leading plastic surgeon from Durban in KwaZulu-Natal believes more could be done to curb COVID-19. Dr. Stephen Simango joins us now live via Skype from Durban, KwaZulu-Natal. Doctor, thank you very much indeed for your time.
Thank you so much for having me.
Look, it's always a pleasure to bring in the medical experts here to talk to us through this. This is a medical emergency that we are going through. So I guess science needs to lead in this regard. So thank you very much indeed for your time. What more can be done, Doc, with regards to the fight against COVID-19 in South Africa? What's your thoughts?
Thank you. Good afternoon, South Africa. We've got a role to play. And our aim should be to arrest the disease before it comes. We should aim at getting the people that are affected before they are admitted into ICU or in hospital. So I suggest a few things, that all sectors do come together, have a summit. Secondly, that we can do some things where the community can participate and help each other in terms of monitoring the disease. There are some specific symptoms, about 10, which I can identify, which we could monitor ourselves as people. During this lockdown, we are all seated at home. We could share that information, that today, say I have a cough. We give you a number, you SMS, you log onto an app, you dial a number, and where you can log in your symptoms. All your symptoms are then collected to say, yesterday, say you were well, you can log 000, you were well. We need that information for our stats collection, big data analysis, from which then we can compute all these symptoms depending on the location of the person. Each one of us, every day we wake up, we send to a central place how we are feeling. Do we have a cough? We say, I'll give an example. Say in Umlazi, in Durban, we got 2,000 people that they've got a cough. We know there's a problem there. Something is coming. Yesterday, these people were not coughing. Today, they are coughing. We can therefore be able to redirect our resources to these places and therefore streamline our limited facilities that we have.
All right.
Unlike with other countries that can do extensive testing, we in Africa cannot afford so much of
Let me engage you with regards to that. So we know that some of these symptoms for COVID-19 is similar to flu-like symptoms. You mentioned the cough as an example. How do we know that we are not directing resources to a particular community who has a cough that could be just the flu and not COVID-19? How do we process that?
Remember, every day you are telling us how we are feeling. And we know it's not only you that we are assessing. So whatever is happening to you, it's happening to the community. But there are specific things that we look for in COVID-19.
Right.
They are saying now the loss of taste and loss of sensation, loss of taste is one of the early symptoms of COVID-19 disease.
Correct.
And if one is starting to get these, and there are about 10 which we can list, each of them can be given a certain severity, and therefore one can roughly test and say you are towards which flu, unlike towards the COVID-19, depending on your score. Which big data can help us analyze that.
So I get you. I get what you're trying to say. You're trying to say we need to use more technology in order to get ahead of this virus. To, we're using these modelings as well. You know, the health minister was talking about modelings yesterday, using certain models in order to project what we can expect with regards to COVID-19. So I guess the more information that we have, the better. But how realistic is it, though, Doc? I mean, do we have the manpower? Do we have to take on such an undertaking like this? What's your thoughts on the ground? Do you think we can do it?
For those of us maybe that are gifted or have acquired iPhone, use of an app to monitor this would be the starting point. We're currently trying to develop one. We would ask also the cell phone providers. SMS is what the people in the township can afford. They can also log that.
Yeah.
The landline, we can adapt it in order for us to log the data using landline, and each of those symptoms would give a score.
Doctor, I know we're fast running out of time, but I just want to...
main computer people...
I'm sorry, I have to cut you off, but I just want to get in one more question. I see you using these gloves. We're talking about PPEs here. I mean, on the ground, are you getting a sense that there's a lack of PPEs for medical personnel out there?
Our resources are limited. We are not the only ones asking for this.
Yeah.
The whole world is asking for this. And therefore, we've got limited resources. Our big challenge is that they are scattered.
Yeah.
Each small clinic, each hospital is getting a small amount which they are keeping for their patients.
Right.
I work at St. Augustine. Got problem that each hospital and a small clinic is keeping the N95 mask. Why don't we all combine these resources? Identify one center. For now, put all those resources into one space. Give our staff, our patients, the maximum protection and monitoring that they deserve.
Yeah. Look, it's important indeed. Doctor, thank you very much indeed for coming through, giving us your perspective on some of the realities on the ground. We appreciate it.